Okay, I think we are live. Okay, are we good, Daniel? Yeah. Okay, welcome to this live stream. We are excited to be with you all here tonight. Over the next few minutes, we are going to be revealing the plan that our customers purchase more than any other when they go on Medicare when we first help them. So we actually pulled a report of the last 25,000 clients that we have helped, and 71% of them have purchased this plan. If you're a client of ours, there's a 7 out of 10 chance you're covered by this plan. So we're going to go over that. And then we're also, obviously it's AEP, annual enrollment period. Actually, it's not yet. It starts in 5 days, but it feels like it already. And so we're going to just share some different things that we've already been coming across and learning this AEP. And we want to take your questions and answer them. We'll have a lot of fun here tonight, hopefully. So once my dad, this is Marvin, he's going to talk about the one plan that rules them all, and then we'll hop into question and answer time. But before we do that, go ahead, drop in the chat where you're from. We love to see where you are tuning in from tonight. We are sitting in our headquarters in Overland Park, Kansas, which is a suburb right outside of Kansas City. My name is Josh Music. This is my dad, Marvin Music. Most of you may know us or may not know us, but we started this company, MedicareSchool.com, years ago, and we set out with a mission really to change the way people go on Medicare the first time. And what I mean by that is we kind of looked around the whole landscape of people, and there's 3 or 4 million people every year going on Medicare, and they were all just getting shoved into a plan, not understanding what they were buying, oftentimes being lied to by sales agents who just wanted to chase a commission. And so we set out to flip this whole thing on its head. So we started MedicareSchool.com, and we start with education. And what we've learned over the years is if we can educate people, they want to do business with us, and they'll call in and want to purchase plans through our team. And so this annual enrollment period, we would love to assist you or assist your friends and family. But our promise is that we will always start with education and do what's in your best interests, not what is in ours. Okay, so let's see where everyone is coming in from. Louisville, Kentucky. Welcome, Carol, Vera, Deborah from Charleston, South Carolina, Russell from Surprise, Arizona, Platte City, Missouri, Tim from Metro Detroit area in Michigan, Rita from California, Joe Forrest from Michigan, Mr. Chapman from Kansas, Virginia, South Carolina, Canadian, Texas, I've never heard of that, Pollock Pines, California, New Jersey, Washington State, Virginia, Arizona, Detroit, Michigan, Holiday, Florida. Hopefully you, and I don't know where Holiday, Florida is, but hopefully you're safe. Lafayette, Louisiana, South Bend, Indiana, Huntington, West Virginia, David Mills, thank you for joining us. Pat Rush from Florence, South Carolina. Okay, we're all over the country, so we've got a lot of people to cover. So let's hop in, Dad.
Yeah.
Go ahead.
That one I saw from Surprise, Arizona, I think that's where the Royals... It is, okay. Yeah, we've been there. Yeah, that's pretty neat. All right, well, it is good to have an opportunity to be with you all tonight. I want to mention something, even Josh, before I get into the topic, something that you said that I think really has allowed us to be unique in this business, and that is for those of you that are not yet on Medicare and are going to go on Medicare maybe the next few months or a couple years, we actually help people get into the Medicare system. All of our agents know how to do A and B enrollments. For those of you that are starting Medicare after 65, you have a different enrollment called special enrollment, and there's some additional paperwork involved with that process, and our agents will make sure all that's done properly, done on time, and so we'd be happy to guide you through that process as well. Not just set up insurance, but to make sure your A and B is set up correctly. Occasionally people make mistakes with that, and we certainly wouldn't want you to have any problems or penalties because of that. So if you reach out to us and want us to be your broker, we'd be delighted to take care of that A and B enrollment for you. So just kind of keep that in mind. All right, let's talk about 71% of plans that are purchased with our company are the same. We get asked all the time. I especially get asked because I'm getting close to Medicare eligibility, about, let's see, 1 year and 2 months. I'll be on Medicare. And people ask me, well, Marvin, what would you do? And so I will tell you what I would do. In fact, I'd be within the 71% for sure. But when people go on Medicare, they have a couple of options for sure. And I think all the options have some warrant to them depending upon your situation. But we think it is necessary to make sure that that when you choose a plan, that it's just not something that we're pushing and trying to get you to do so we can make a higher commission. But it's a plan that you really understand, because what happens is you have to make sure that you know how your insurance is going to work when you go on Medicare. And you're going to care if you get cancer, you have a heart attack, or something happens to you, you will care how that insurance works. And so we're committed to educating our clients about how their insurance is going to work should they really need it. And so you have a couple options. You have Medicare A and B, which is traditional Medicare with supplemental plans. And then you have Medicare Advantage plans, which of course are private health insurance company replacement plans. So those really are the two big pictures within the Medicare system. And those kind of insurances, they work differently. And so we emphasize the differences of those two systems. And so what happens when someone decides that they want to stay in the traditional original Medicare system, there are gaps, and so we buy supplemental plans to fill in the gaps. And so the reason that people like supplemental plans with original Medicare A and B is because, number one, you never have to worry about a network at all. Advantage plans, you always have to be concerned about networks. It's going to be either an HMO network or a PPO network. HMO networks always look the best on paper because they have the lowest copays, the most amount of perks, the lowest max out of pocket. But the problem is you have less providers that you can go to on those HMOs. Plus, if you go outside the network, you don't have coverage. And so that's the issue with HMO plans. With PPO plans, larger network, can go out, don't have to have referrals and those kind of things, but it costs you more on the PPO plans. And so with the comparison between Advantage and subs, that's the first thing that we want people to be aware of. You will have networks with Advantage, but you have a supplemental plan, you don't. You actually can go to any provider as long as that provider takes Medicare. 99% of all doctors take Medicare, and 100% of all hospitals do. So the point is, when you select a supplemental plan, you can go anywhere you want. To me, that's a big deal. You don't have to worry about some insurance company dictating where you can go to the doctor, what specialists or what surgeons you want to have. The second thing about taking supplemental plans is you never have to worry about a pre-authorization by the insurance company. The insurance company has to follow Medicare. So when Medicare says they'll cover a service and your doctor says you need that, it's not the doctor recommending, it's the doctor ordering that service, and you're going to get that, whether that's a scan or a surgery, extended skilled nursing stay. But when we stay in that system, the insurance company can never delay, can never interfere, can never deny your coverage. And that's a big issue. With Advantage plans, that happens 7 out of 10 times. The insurance company has the final say-so. They have the mandatory pre-authorization right to say, no, we don't agree with the doctor, or yes, we do. And many times they will agree, but sometimes they don't agree. They delay a surgery. They want you to go to therapy first. They want you to take meds first. We've had people that needed a full hip replacement. They denied it and said, we'll pay for a rod only. So those kinds of things happen in that system. So again, we educate how that's going to work. And then the last thing, and then I'm going to answer the 71%, is that when someone takes a Medicare supplemental plan, it's a permanent policy. It's theirs for life. It's tied to them. And as long as they pay the premium, the insurance company can never cancel that supplemental plan. So it truly is lifetime. You can take it with you if you move from one state to another because it's portable. Not so with Advantage. They're not tied to you. They're tied to a service area. There's 34 service areas in the country. They're tied to that. So you move outside the service area, you don't take the plan with you. You have to get a new one. And so those are the differences between those insurance systems. And so what happens with our company, actually 21% of our clients buy Medicare Advantage plans. In other words, they said that is the best fit for them. And our commitment to them is to make sure that we find the very best possible plan we can for their particular situation in their location. So 21% buy Advantage plans. And so, though sometimes, I'm honest about them, I'm not trying to discourage people from getting them, because sometimes that's the only option, because people cannot afford a premium for a supplemental plan. So it's 21% buy Advantage plans, and then the remaining 71% are going to buy G plans. And then we have actually 8% of our clients that buy N plans. And so you can kind of see there that 79% of all of our clients are buying supplemental plans, and 21% are buying Advantage plans. And frankly, that's just the opposite with other brokers. The majority of brokers sell Advantage plans. In fact, most of them, that's all they want to sell. It's a very quick sale. It's an easy sale because they're either low or no premium, but they don't take the time to really educate you about how that's going to work. And so we have agents, 99% of what they write are Advantage plans. Sure, they write them, and we make more money when we write Advantage plans, but the question is, do you have the best coverage for you? Do you have the kind of insurance that really is going to work for you if you have some kind of health issue? And I'm not convinced that you do. And so that's why the majority of our folks are still buying supplemental plans. And so 71% buy G plans. Why is that? Well, it's because it's the most comprehensive coverage that's available today. There used to be a plan that was more comprehensive, but most people can't buy that today. That was called the F plan. When Medicare changed the rules, people starting Medicare after 1/1/2020 can no longer get F plans, so your most comprehensive plan is a G plan. And it covers everything except the Medicare B deductible. So once a year, whenever the B deductible is set by Medicare, you would be responsible for that out of pocket. And after that, you have no out-of-pocket expenses. As long as Medicare pays first and you're seeing a provider that takes Medicare, you have almost 100% coverage other than the annual B deductible. Now, we don't know what that's going to be yet in 2020-25. We're waiting for that final number from Medicare. But this year, it's $240. So when someone had a G plan, that's all they would pay out of pocket, other than, of course, the premium. The plan below that is an N plan. It's also a wonderful plan, a wonderful option. The reason that people will get an N plan is because there's a premium savings of about $40 a month. So they're going to save about $480. The only difference on the N plan with the G is you do have to pay excess charges if and when they occur. They are very, very rare. Less than 5% of the time would we ever even see an excess charge. Now, that could change in the future. We don't know. And then the N plan does have a couple small copays. You go to the doctor, you can pay up to $20 copay. If you go to the emergency room, you pay up to $50 copay unless you're admitted to the hospital. So the point is there's a difference of about $40. Now, we do have a couple states where the difference is $100 or more a month. And that's when I think it really, really could make sense. But the point is, most of our clients are buying supplemental plans because they understand what they're getting. They care about how their insurance is going to work. They're not just looking for the cheapest thing, that has a few perks that are attached to it. And so we educate people. They've gone to our YouTube channel. They really understand how important this decision is. And then lastly, people understand that once they have been on an Advantage plan for a year, 2, 3, 4, 5 years, and they want to get off of that Advantage plan, in order to get off of Advantage and move to a supplemental plan, in all but 5 states, you have to actually medically qualify to make that move. So sadly, some people go on Advantage because they're cheap and they're attractive and they're healthy, and then they stay on a few years and their health changes and they get a diagnosis that's serious. They can never get off of that Advantage plan. They're in that system the rest of their life. Now, do they still have insurance? Sure they do. But is it going to work as well as what they would like to? Maybe not. Why? Because of the networks and because of the pre-authorizations that they'll have to live with in that system. All right, so 71% of our people today are buying G plans. 8% are buying N plans. All right? Okay, enough said of that. So we'd be delighted to help you with any of the above.
Okay, let's hop into questions because there are already a lot. And as we get going, there's always a lot more. So, Jay Jarman, currently use welfare for my Part D drug plan. I'm guessing you probably mean WellCare. The F and the C are near each other on the keyboard. So currently use WellCare. You take these 2 drugs. Doesn't appear I need to change. So let's just talk through Part D changes. Like what's happened not only this year, but how drug plan changes work in AEP. You want to cover that?
Sure. Okay, what happens, drug plans like Advantage plans are only written for 1 year at a time. That's it. Drug plans, Advantage plans are a contract between Medicare, the insurance company, and you, the person who enrolls in the plan, and it's a calendar year plan. And so when these plans began years ago, the government gave the Advantage plans the right to be able to change anything they want from year to year to year. And so that's why we are going through this Medicare AEP season, because the insurance company has the right to drop the plan, they have the right to keep the plan the same, they have the right to increase it, decrease it, they really can do anything they want with the plan. And so they have to notify you about that, and those of you on those plans have been notified by now through your annual notice of change. And you should be looking at how those plans are changing. some of the plans will be dropped. In fact, this year, 2024, on average, we've had about 25 drug plans in the market, per market on average. Some a little bit less, some more. But point is about 25. This year, as we go into 2025, you're going to see at tops about 15 drug plans. Some even have less than that. But you're going to have about 15 drug plans. So we have several of them that exited the market. They've just dropped out of that because of some of the changes that Medicare has made to Part D insurance companies. Number one, what they did is the insurance companies now have a much greater financial responsibility for the cost. Medicare transferred those costs to the carrier. And so the insurance companies are now having to take on a lot of risk because the max out of pocket on any Part D plan today, if you have a covered medication in formulary, is $2,000 out of pocket. And so because of that, these companies had to restructure their formularies. They've had to restructure a lot of things within the plans. Yeah. And so you're specifically asking about WellCare. Here's my advice to you. If you've read through your annual notice of change and that your medications are still covered, then that plan is probably still going to take good care of you for 2025. And so what I would do then, if you still like the plan, let it automatically renew. I know some of the WellCare plans have gone from $0 to maybe $20 a month premium. Some have stayed the same, so there's been no difference. But the point is, if your meds are still covered, I think you're still fine on that particular plan.
So I'll talk about WellCare for a minute. So WellCare decided this year, they notified us, so there's about 160,000 Medicare insurance brokers like us around the country. And WellCare decided about a month ago that they were just going to cut ties with brokers on their drug plans. And so we have, like our client base, we've got about 24,000 people that use WellCare prescription drug plans. So all of a sudden, we're just cut out of this equation. So really, you have to go directly to WellCare on that. So what we've been doing for our clients, because people that join us generally want to stay with us and not just get kind of abandoned. It's nothing that we did. It just was a decision done by WellCare. Is we've been walking people through a process to get a drug plan recommendation from us. And it's really easy. It's 3 steps. Let me see if I can share my screen, and I'll walk you through this. Some of you might have seen this, so I will go through this quickly. Hang on just a minute. Right here. So if you want to get a RX plan recommendation from us, and this is really for our clients, I think we probably have a lot of clients on here that are watching it, but you should have got a text message from us. And if not, you can call in. But you can start this process just by raising your hand and saying, yeah, I want you guys to give me a new drug plan. Daniel, can we put that in the chat? Where they start. Hang on, I can do it real quick. So if you start on this link that I just dropped into the chat, you can raise your hand basically and say, hey, I want your assistance with this. And what it's going to do is it's going to walk you through a couple more steps. The second one is to update your meds in our plan switching site. Just go in, log in. You should have a username and password. If not, you can just create a new account. And then we will, once you've done that, there's one more step. And basically you have to say, hey, I've updated my meds in this site. Once you've done that, we will take about a week, and then we'll actually email you a drug plan recommendation and an enrollment link. Because we have a lot of people that are on WellCare, and they're going, hey, we still want to stay with you guys. We don't like that WellCare is just kind of abandoning us to who knows what kind of customer service. I'm hearing that most of the calls are going to the other side of the world for WellCare. And so if you want to stay with us as your broker on your drug plan, you can follow this process. So just raise your hand, go to that link, and then it'll kind of walk you through the steps. It's really simple way to get a drug plan recommendation from us.
Yeah, but if you feel within your heart that WellCare is still your best option, do it.
And we've seen,
by all means.
Like insurance companies do this before. They think, oh, hey, we'll just cut the brokers out and we'll save a little bit of money. And what happens is service pretty much goes downhill for a couple of years, and they come crawling back a couple years later and go, hey, actually, we want to work with brokers again because there's 150,000 of you, and we can't staff up that many people to take care of everyone. So anyway. Yeah. That's that question. So Alan Clark, I heard there were changes from WellCare. I have a plan now, somehow ARP. What should I do? You can follow that process I just laid out, that link that I just posted, and you'll get a drug plan recommendation from us. It won't be WellCare because they cut ties with us and everybody else. So Tom Levesque says, I would like to know if you will comment on who would benefit the most from choosing traditional Medicare.
Well, actually Medicare does, and you do. The reason Medicare does is because it costs them, and again, this is not, yours and I big concern other than we're taxpayers, I care, but it costs them right now, it costs Medicare 22% more money to cover people on Advantage plans than it does to cover them on traditional Medicare. So number two, you do. And I'm going to tell you why you do. Because now you can go to any provider you want to. You have no pre-authorizations by any kind of insurance company, and you have a permanent portable policy. So if you want to talk about quality insurance, you definitely have that with traditional Medicare as long as you get a supplemental plan to fill in those gaps.
Okay, what are the changes for Medicare Parts A and B for 2025? We don't really know yet. All that stuff has not been announced. But this is a good opportunity. So if you're on YouTube, many of you are, hundreds, maybe 1,000 of you are, click the subscribe button on YouTube. It's free. You're just clicking a button, and basically what that does, and then there's a little bell notification, right? Is it a bell? Okay, so hit subscribe and then hit the bell. And whenever all of that stuff gets released, we will release a video pretty quickly, and you'll get to see all of the updates and all the changes for next year. So hit the subscribe button. If you're not already subscribed to the channel, ring the bell, and then you'll get notified when all that
Should
happens.
be out really, really soon, and we'll shoot a video covering all the changes.
Yep.
Yeah.
Okay. William Gregg says, I think it would be a good idea to comment on the standalone Part D plans and the basic differences between low or no premium ones and the ones that are over 100. What's the difference?
Okay, sounds good. Standalone prescription drug plan is what someone would get whenever they decide to stay in traditional Medicare A and B and get a supplemental plan. A and B and SUPs cover medications, but only professionally administered meds, inpatient, outpatient meds. So for our self-administered meds, we have to have this standalone drug plan. Now, if I decide to go with a Medicare Advantage plan, that Medicare Advantage plan actually selects a Part D plan and embeds it within the Medicare Advantage plan. So it's called an MAPD. Medicare Advantage covers me for in and outpatient, and the PD is for my Part D plan. All right, so in regards to premiums, what happens is not all formularies are going to be the same. A formulary is a list of the medications that are covered. So typically when we see a higher premium plan, and I'd say higher premium meaning probably $45, $50 up, he mentions 100, then those are plans that are going to have a broader formulary. There will be more medications that will be covered by the plan. If I have a plan that's going to be $0 to $20, it's still an all right formulary. I think on average they have about 2,500 different medications that are covered by the plan. If you have one that's going to be $50 plus, it could have as many as 3,500 to 4,000 meds covered in that formulary. So what you're paying for when you have a higher premium is a broader formulary to get all your medications covered. Now the truth is the majority of people are only taking a few medications anyway. They would be fine on a very no or low cost plan. But if I have someone that's taken 8, 10, 12 medications every day, prescriptions every day, and some of those being brand names, they're probably going to have to be on a better formulary. Therefore, they're probably going to have to be on a higher premium. But keep this in mind, folks. With the $2,000 cap, the most you're going to spend out of pocket on your medications is $2,000. So it's smarter to go ahead and have a higher premium plan. It'll be $2,000 you pay out of pocket for meds plus the premium. But I would much rather have a broader formulary and pay a higher premium for that so that I can get all my meds covered because I'm still going to max out at $2,000.
Okay, they canceled my mother-in-law's Florida Blue HMO plan. Can she sign up for traditional Medicare without having to qualify?
Yes, she can. She will be able to do that. She will qualify for a guaranteed issue move to a Medicare supplemental plan. Now, I would tell you this. In most states, it's going to be based upon when she started Medicare. Florida may have an exception to this, and I'm sorry. But we write in Florida. In fact, a lot of business in Florida. But if you have this right and you're and started Medicare before 1/1/2020, so you started before 1/1/2020, your guaranteed issue in most states would be an F plan. If you're starting Medicare after 1/1/2020, your guaranteed issue would be a G plan. But I do think Florida is one of those states that has an exception. And so you'd have to call in. Our agents for sure would know which plan she'd qualify for. I'm thinking it's also an N in Florida.
Okay, Pram Broker says, my wife has Plan D with WellCare. Her premium is 40 cents a month. Why would she change if her plan is very economical.
Yeah.
She doesn't have to.
Yeah, no reason. If you're happy with it, meds are still covered, go right ahead and do that. And if you're our client, we're just saying, hey, we can still service you on your med sup. We'll take care of your problems. But if you do have an issue with them, you just have to go direct. That's all. No problem. So I would say stick with the plan. If you like it, I would too.
Okay, Dennis Doan says, will Social Security issue Medicare ID number on the date that I'm able to apply? What does that mean?
No,
You get it
they're
90
not going
days
to.
before, or 100 days before.
Well, yeah, it's going to take about usually 2 weeks for them to process that Medicare A and B application, and you can usually get that online. They'll actually show you a status. The card will probably take 4 weeks, but the Medicare ID number takes about 2 weeks. You can get it online, but it's not immediate.
Yeah, if you're turning 65 and you're already on Social Security, though, you're going to be automatically enrolled into Medicare A and B, and you'll get that Medicare A and B card about 100 days in advance.
100 days.
If you have to self-enroll, because you're not taking Social Security, right, you will then get that number probably 2 weeks later. You can get it by logging to your SSA.gov account, and then a card arrives about 2 weeks after that, right?
Yep, you're exactly right.
Okay.
Yeah. So what's happening? Anyone that's turning 65 in February coming up, you're going to get your Medicare card in the mail this month.
Yeah,
If their birthday's T65. That's if you're on Social Security. That's what Josh was saying. If you're not, you have to self-enroll.
Okay, Bert Lamboy says, Marvin, if I choose a Medigap program, what is the cost for a prescription plan to add on?
It just depends on the medications that you take, Bert. We make that decision after we know your meds because we're trying to match up your medications with even pharmacy choices as well. I've been looking at a lot of plans lately, and there is a significant difference between preferred pharmacies and standard pharmacies because a pharmacy could be a network. I looked at a plan today out of Texas, and one of the grocery stores was Kroger, and they were in the network, they weren't preferred, and the prices were substantially higher. And so that's why we ask you, give us some retail options so we can check your medications based upon those retail options. And but let that system decide that. You don't just look at the cost. You look at coverage of the meds.
William Gregg says, they state if you move that you have a guaranteed issue right to move to a supplement, but is that moving across town, out of state? Yeah, it's out of state.
Yes, I think it's moving out of state and out of your service area
Planned
for
service
sure.
area, yeah.
Exactly right. So yeah, it's not across town for sure.
Yvette Neal says, I turned 65 in May. Since Social Security is slow processing retirement, I have applied for it this month. I'm certain it may not start the application until December. I guess that's not really a question. I'm
Yeah,
sorry.
okay.
Okay, I received a letter from my Florida Blue Advantage HMO stating that I will not have prescription coverage unless I read it wrong. Did anyone else get this notice? You could have gotten such a notice. I know there's a lot of shakeup down in some of these Florida plans, but here's what you can do. Call our number at the bottom of the screen, 833-833-3661. You guys are going to see that. We've got about 100 people outside that door that are ready, willing, and able and want to help you guys figure this out. So if you need prescription coverage and you're on a plan that you got a notice that said the prescription coverage is stopping, give us a call. We'll help you get on a plan that makes sense for you.
Yeah. What's interesting about that, I've never heard of an Advantage plan just dropping the prescription drug component. I've never heard of that. I've heard plenty of times when they're dropping the plan totally, that it's not even going to be available any longer.
Well, here's another one. Susan Sirico, I got a notice they will no longer offer my Humana plan.
Yeah,
and that is true.
true.
It's called a service area reduction, and that is happening all over the country this year.
Yeah.
There are more plans exiting the market this year than there have since Advantage plans started, like combined.
I see.
There's a lot
Yeah.
of this.
Yeah, I think Humana is it's 600 to 700,000 members that will be without Humana. And here's why, folks. The plans are not really concerned about growing anymore. They're just only concerned about profitability.
Yeah.
And if they can't make money in a certain market, they're pulling those plans.
Greg Davison, what choices for coverage when overseas or traveling to Canada or Mexico?
Okay.
Can you address that for both SUPs and Advantage?
Oh, yes. So now when it comes to Advantage, the only coverage you have outside the U.S. would be for urgent care or emergency room. That's it. And you'd have zero copay in those situations. But if you go to the hospital and you're on a Advantage plan, you have no coverage. Okay. Now, if you are on a supplemental plan and you travel outside the U.S., Canada or Mexico, 6 of the 10 plans certainly the F, G, and the N all have what's called a foreign travel emergency benefit. Foreign travel emergency benefit, and basically to look at it, it's a $50,000 lump sum that's added to your policy, available for you for any foreign travel emergency claims. And so it's $50,000 lifetime. And so if you have a claim, the way that they settle out the claim is you submit the claim, and you have to pay the first $250, so you have a $250 deductible, and then they take the balance of that claim, and the insurance company pays 80% of the claim, and you pay 20%. But their 80% stops once they have spent $50,000. And that number is not replenished. It's not per claim. It's per lifetime benefit of the policy. So what I recommend, Greg, when you travel, get some travel health insurance. And the big thing is air evacuation riders. Be sure you get a good travel policy that has air evacuation included. Usually they'll cover about $1 million for air evacuation. And that's important.
LNK says, I'm going to supplement Plan G for this year, and I would like to stay on it next year. Is it automatic, or do I need to take additional actions to probably renew the same plan for medical that I have now? If it's a supplement plan, it is yours for life. They can't cancel it on you. You don't have to renew it every year. It's yours for as long as you want it. As long as you pay the premium, it's yours.
That's right. It's called guaranteed renewable. So that's one of the beauties of supplemental plans.
Let's see. Okay, a relative signed up for an Advantage plan less than 6 months ago. Can they switch to a supplemental plan? If not, can they sign up for a copay protection plan now or just during the open season effective January? They can get a copay protection plan now. Anytime. It doesn't really matter. It's not really an open season thing. You can pick that up at any time. If you're at a certain age, you may have to answer a couple health questions. As far as switching to a supplement plan, possibly there are some rules that might not be the first time. I just don't know. Like,
I see.
There's something called a trial period that they may qualify for. It's a little tricky.
But if they're within 6 months of their B date, what I would say, Teresa, find out what their B date is. And as long as they're still within 6 months of their B date, they can immediately get off the Advantage plan and move to a supplemental plan with no underwriting at all. So full 6 months. So if they would have started, let's just say they would have started in April. They'd have all April, May, June, July, August, September. So that's too late. So they're May, June, July, August, September, October. So if their birthday and effective date for their Medicare B was May 1 of 2024 or after, they're still within that 6 month window where they don't have to medically qualify to get a supplemental plan. Again, call the number. Our agents certainly know how to walk you through that process and help them.
Okay, the old crow is asking, can you add a Medigap to a health advantage plan?
No, you can't. In fact, it's illegal. You can have, it's either one or the other. If you have an Advantage plan that you cannot get off of now because your health has changed, you can add a copay protection plan or indemnity plan to cover some of your out-of-pocket exposure on your Advantage plan.
Okay, Creditable Coverage letters. We received a boilerplate letter from my husband's employer. Contains specific info regarding the coverage, but it is not personalized. Does it need to be?
Yeah. Well,
I mean, surely it's got your name on it.
Yeah, but also if they're saying that the plan is creditable, that would be good enough for me.
Yeah.
Okay. Yeah, I would be fine with that.
Okay. Okay, Larry Johnson, you asked if the prescription drug plan that your service recommends is the same as what I already have. Do I need to reapply? Okay, so you're going back to that thing where you're going to go through that process to get a drug plan recommendation from us. If we recommend the same plan that you're on, then there's nothing you need to do. It'll auto-renew, and that works, that's for every drug plan that you have. If you don't want to change anything, just don't change anything as long as the plan hasn't canceled. There's a lot of questions, so we're going to get to them. I did want to just make note of this. There is a phone number scrolling along the bottom of the screen, 833-833-3661. If you need Medicare assistance, we have the people answering the phones are going to be here for another about hour or so. So you can feel free to call in, schedule an appointment to get on the books. We will start filling up very, very, very quickly for AEP, for annual enrollment period, which starts on the 15th. So give us a call, get in line. If you're a current client, you will go to our coverage renewal team. So the reception team will know if you're a current client or not. But if you're not a new client, you'll go over to a different side of the house, and they'll be able to set you up, shop all your plans, and everything. So
yeah, I just want to add to that. So it'd be 7 to 7. Our hours going to be the same during AEP?
Yeah.
Okay, 7 to 7, Monday through Thursday, 7 to 6. on Friday. And so we actually have 16 receptionists. So when you call in, they'll triage the call, figure out what department you need to go to, and we'd be delighted to serve you and take care of you.
Melanie Roper says, how much would it cost for you to help us enroll? It doesn't cost you anything. What we do is a free service. We don't work for free. We are paid by the insurance companies that we represent, so we're independent brokers. But it doesn't cost you anything. It doesn't cost you anything extra to work with us, but you get our support, you get our assistance, our direction. And we really put a lot of focus on our customer service team and making sure that they're there for you all year round. We're not shipping your phone calls off to the other side of the world.
And really, Melody, it's no different than your homeowner's insurance, your auto insurance. The agent doesn't work for free, but the agent's always paid by the insurance company. Same thing with health. We are paid by the insurance company, not by you, and that's the beauty of it. Like John said, hey, we've never ever sent a client a single bill. We're not paid by our clients. We're paid by the insurance carrier. So let us help you.
Cheryl says, I hear all plan ends are the same thing. Only difference is the provider, correct?
Okay. And it is true. And the same thing would be a G plan or an F plan. Any supplemental plan you have is standardized by Medicare. Medicare sets the rules for what bills are going to be paid. So if you got an N plan, let's say from ABC Insurance Company, you're got an N plan from XYZ Insurance Company, the coverage will be identical. We would never select a carrier thinking or hoping that one carrier is going to pay better than the other, because they don't. Medicare has already set the rules for what's going to be covered and not covered. They're standardized plans. So whoever told you that, exactly right. The difference would be the insurance carrier. But I would tell you, not just by name, but also the premium's going to vary, but most importantly, the stability of the rates. So you want to go with a carrier, in our opinion, based on one that's more national, not regional, because the national carriers tend to be more stable over the long haul. So we look at initial premium, but also what do we expect that rate to look like in 3 years or 5 years or 10 years down the road, and we take the time to look at the stability as well.
Okay, AR Ford says, I filled out the Medicare enrollment form, but I never got a confirmation from you all after I sent my login information. What do I need to do? I'm not exactly sure what you were referring to, AR. If you drop down, maybe if this is the shop your prescription drug plan thing, if that's the case, call in to our number, and they'll be able to tell you, confirm whether or not they've got everything they need. So, okay, let's keep going. What does MA mean when getting insurance? What is the average cost of a supplemental plan for someone who's fairly healthy?
Okay, well, of course, it just depends on age and where you live. But I would say this, roughly speaking, I would look at a G plan right now. Someone turning 65 going to be in the neighborhood of about $140 to $150 a month range. Your in plan is going to be in the neighborhood of about $100 to $110 a month. Again, certainly there could be some states a little bit lower, some higher. We also have what's called a household discount. If you do not live alone but have someone else that lives with you, be it a spouse or even a child sometimes, you can get a discount there. If you're married and husband and wife are on the same with the same insurance carrier, we get another discount for that. So there's a few variables that go into that. But I'd say G's, 140 to 150, ends $100 to $110 a month.
Yeah, and in certain states they can be.
Yeah, they can be more
than that,
for sure.
So.
Yeah, I'm just saying average across the country.
Rubio Isabelita, a friend wants to switch from Advantage to Medigap. They need help. Hey, just give them the phone number scrolling across the bottom of the screen. Yep. We would love to assist them.
Yeah, please. We'll help them and do them right.
David Mills, Marvin, have you ever talked to an MD who chose an Advantage plan for their own health care?
Never. Never. And I'll tell you why, because the doctors and nurses and even coders, they understand the problems that people will have with Advantage plans when it comes to pre-authorizations and network issues. I kind of describe it like a mechanic, and I'm not a mechanic, but I know mechanics know their business, and they know typically when the transmission is going to go out or when the timing belt's going to go, and they just know all about it because they're under the hood every day and they see how those cars operate and they see the problems. And that's the way it is with people in the healthcare business. They're under the hood. They see the issues that come up when people have Advantage plans, and that's why they avoid them. I've never had it. I've never had a nurse, never had a doctor, or even somebody that was a coder. Really, probably especially coders. I was doing a workshop once in St. Louis, and at the end, a lady stood up and said, hey, I do coding, and I would never do an Advantage plan. She said, because of the problem. So, Good question.
Glenda says, do we pay you for the supplement plan or do you get it from Medicare? So supplement plans generally are offered through independent brokers like us. So you call us, we shop, compare all the options, hopefully help you find the plan that is the least expensive, best value plan.
And you pay the insurance company.
Yeah,
Glenda.
you don't pay us and you don't pay Medicare for a supplement plan either. So you can't call Medicare and get a supplement plan. They're offered by insurance companies. Let's see. I plan on staying with original Medicare. I have Aetna Plan G. What changes with this plan? Nothing.
Yeah, the only thing that can change on that, Catherine, would be the premium. That's it. Your coverage is locked in for life. You have one responsibility, the B deductible once a year, and that's it. They can never change the terms of that policy. Just the premium can and will.
Cindy Patrick says, we're waiting to see our health plan premiums increase. He's in the F pool. I'm in the G. Hey, Cindy, if your husband is in the plan F and he's semi-healthy, please call us. We can save you a lot of money. He should not be in plan F any longer.
If he can get off.
Yeah. As long as he can get off, there's only one difference between plan F and plan G. And that is, on a plan F, you don't have to pay the Part B deductible. On the plan G, you have to pay the annual Part B deductible. And that deductible is how much this year?
$240.
$240. So generally, you're going to save somewhere around $50 to $75 every single month by switching to a Plan G, and all you're picking up is a less than $250 deductible. So it really just makes sense. Plus, the people that are on the F plans now are generally people that are getting older because they got in it a long time ago, and there's no new, younger, presumably healthier people that are getting on F plans because they can't get on F plans. So that book of business, that Plan F block, is getting older and older.
Smaller.
People are dying. It's getting smaller. People are getting sicker. There's more claims. So those premiums start going up quickly. So we always tell people it's a good idea every 4 or 5 years, shop your plan if you haven't. You can do it more often than that, but every 4 or 5 years at least, shop your plan. Try to get into a younger pool of people. Right?
Right.
Okay, Medicare Gleason says, my husband recently went on Medicare after his 24-month waiting period for disability. How is this different than normal Medicare, and will he age in at 65, and will that make any difference? Yeah.
It does. And Margaret, really, it just depends on where you live. One of the biggest differences is there's no federal law that says that when someone comes into Medicare because of Social Security disability, that the insurance companies have to offer supplemental plans. Now, there are some states that require insurance companies to write supplemental plans, and there's other states that say no. So the difference would be, depending on where you live, I don't even know if he's eligible for a supplemental plan because they may not be offered. Sometimes those situations, people just can get advantage plans. Now, when he turns 65, he's going to have a second eligibility. In fact, we call that his IEP2. So he can make decisions now based upon his Medicare eligibility because of Social Security disability. Hopefully you live in a place where he can get a supplemental plan, and hopefully you live in a place where they can't charge excessive rates for that, because sometimes they do. But at 65, he can reset the clock, and they'll treat it as though he's never even had Medicare before, because now he can get a supplemental plan, he can pay the normal rates, and so he can revisit everything at 65. So make a good decision now, the best one you can, and then you can do it again at 65. That's the difference.
Okay, John Goddard says, this year I have WellCare for Part D. What do you suggest for Part D in 25? It's going to be a mix. We're seeing a lot of plans become options now that WellCare is kind of taking away the ability to work with brokers. You're welcome to stay on that WellCare Part D plan. We are concerned that service and things is just going to change a lot since they kind of cut everyone out. Generally, an insurance company does that to increase profit, and so they kind of like try to taper everything down just from a profit perspective. So if you follow that process I lined out, you'll get a drug plan recommendation from us of the plans that we will stand behind. But doesn't make WellCare bad. It's just,
if you were to talk to anybody on our customer service team, they would tell you they've been frustrated by hold times with WellCare and getting things resolved. That's a fact. That doesn't mean they're bad company, but we've been disappointed. So you take that now when they had 160,000 brokers servicing their people, and now they're going to service the millions and millions. We had a problem when we serviced a fraction, and now they're going to be servicing those people. But if the plan looks good to you, you're comfortable with that, we're not trying to scare anyone. We're just trying to be honest with you about what's changed in the marketplace.
okay, Dale Bubenhofer on Facebook. Actually, which this is a good point. I'm going to stop here. So we have a Facebook group. Can we put a link to that? So we'll put a link to that in the chat, and then we'll put it on a banner as well. And you can go in, join our MedicareSchool.com community. It's a Facebook group. I think there's like 50,000 people in there. And we have a lady who is in there all day, every day, answering questions. And you can ask questions and you'll get 100 answers from real people who are on these plans, right? So you're not just hearing from a sales team or whatever. You're hearing from actual people who are on these plans. So join that Facebook group, if you will, and you'll see updates from our team. You'll be able to ask questions, get answers from real people, and then also get instructions for how to get in touch with our team if you would like to do so.
And also, every Monday at 5 o'clock p.m. Central Time, I have a session that we call it Medicare Mondays, and we look at all kinds of Medicare topics. I do about a 30 to 45-minute educational session every Monday at 5 o'clock, and you're invited to those, and we'd love to have you be a part of that. For sure. Let's go back to his question. There was something I just want to comment on that. He said that there was something there. Can you go back to that one?
Yes. If one has an in-plan,
right.
Is it possible to have excess charges while hospitalized?
Okay. Well, the only providers that can charge excess would be physicians. So the hospital cannot, skilled nursing facility cannot. That's all covered by A. But if you were hospitalized and let's say you had a surgeon that charged excess, then that could occur. But again, that's not going to be that would not be part of the hospital bill. That'd be part of the physician services. So excess charges only occur on the B side of Medicare. So doctors, surgeons, anesthesiologists. So it is a possibility, just not through the A system.
Okay.
And they don't happen very often anyways, Dale. Less than 5% of the time would we ever even see one.
Hello, Bruce. You get on every live stream. Welcome back.
All right.
Bruce from Rhode Island. Okay.
Glad to have you, sir.
Wolf 2, I have the ARP UHC Plan G. It's a bit more than what was quoted to me when I signed up. I'm in Virginia. Do you have any other companies that might be less on premium with the Plan G? You can call in. We'll give you quotes. We'll see if there's anything that's better. A lot of times if there's a discrepancy in price, sometimes it could be because maybe your spouse is going to be joining you soon and we would have quoted you that. Or if it was over the summer, there's a lot of times where United Healthcare, we will quote you a price and then they'll take their price increase in the next couple of months. And if you hadn't started yet, then you would, you'd be on that new price.
Yeah.
So
Sorry about that. That was definitely not intentional, but it does happen from time to time with them.
are there any max out-of-pockets or limits for those excess charges? Or it's limitless?
No, there's no limit at all. There's 8 states that will not allow it, actually 7 that will not allow excess charges by providers within that state. You go outside the state, it can still happen. But that would be the only limit, if there's a state that says you cannot charge excess. Yeah.
Okay, this is a tricky one. On COBRA, February 2024, used up 2024 unemployment and taking spousal benefits. Wife passed away, will turn 65 in November 2025, but 18 months of COBRA ends August 2025. What to do?
Okay, well, what I would do, I would get a marketplace plan, September and October. Just for 2 months, you have a life-changing event. You can call the exchange. You can call us. We can direct you to someone to help you get that set up. So you need an exchange plan for 2 months. That's it. And you may get a subsidy, you may not, but it doesn't matter. It's 2 months of coverage. And then your Medicare will begin November. So we're only talking 2 months worth of premium. What's that? What's it also?
Okay.
He talks about AGI 200K. Can I use 2024? And yes, you can. You'll have a life-changing event. Let's say used up employment on COBRA. Okay. Can I use? Okay, well, here's what's going to happen. When we start Medicare in 2025, they're going to be looking back at 2023. So you had 200,000. So if you retired in 2024, then you could use the life-changing event and appeal your IRMA. Okay, so and it looks like to me you could, because it looks like you must have worked at least 1 month during 2024. See that? So I think you have the possibility of appealing your IRMA, because you're definitely going to have one if. Also though, here's another thing you also have a life-changing event because your spouse passed away. So that's also an appealable issue. So if your income has been affected because of your wife's passing, you can do the SS-44 form that's appealing the IRMA and submit a death certificate with that, and then you may be able to win the appeal that way. That's probably the best way anyways.
Okay, Deborah McCormick, this is a good question. Applies to a lot of you. If I received an injectable medication at an outpatient clinic in a hospital twice yearly, will that be covered under Part B? And what plan will cover the medication?
Okay, very good. It will be. Almost all injections, infusions, almost all meds that are going to be professionally administered, you're going to outpatient clinic, will be covered by Medicare B. There's actually some meds that people take at home as well that can be covered by B. And so, yes, it will be covered by B. And it won't be a plan, it'll just be original Medicare B, and so the way it will cover that medication, it will cover 80%. So if you decide to get a supplemental plan, the supplemental plan, is the G or the N, will cover the balance of that co-insurance.
Valerie Larkins, I received an email stating that you are not recommending WellCare for Part D prescriptions due to changes for 2025. Will you all assist with getting a new prescription plan for 2025? Yes, absolutely. We put a link in the chat. We'll drop it again real quick. MedicareSchool.com/shop-my-plan. If you go to that, you are going to see a video of me in a green shirt. And right next to it, it says, let us shop your plan for you. And then you'll be able to put in your first name, last name, and email. We will email you instructions for how you can get a drug plan recommendation from us. It should take you 10 or 15 minutes total. Make it really easy.
Good.
Let's see. What's the average cost of a G plan? Okay. Okay, can I switch from Advantage plan while on Social Security disability to a G plan when I switch to Social Security retirement?
Sure. Yeah. Well, actually, you don't have to. Yeah, you don't have to wait to Social Security retirement. You can do it at 65. Yeah. And you may be able to do it sooner than that, but definitely, if you only have the option to have an Advantage plan because of the state you live in, then once you hit 65, you'll have the opportunity, and no underwriting will be required at all.
Okay, I live in Connecticut. Can I be certain that if I start with an Advantage plan and want to switch to original Medicare with Medigap, I will not have medical underwriting?
Okay. Okay. Yeah. Well, Connecticut is one of the states that does have some additional opportunities to be able to get supplemental plans without underwriting. Okay. New York, Connecticut, Vermont, Maine, Massachusetts. So the answer to that is yes. Now, when you say, yeah, what's that? I'm sorry. Can I be certain that if I start with an Advantage plan? What I would do is, why don't you call in, because our agents will verify that. I do know for sure that you're in one of the 5 states that will allow that. I just want to make sure that there's no time limits. I do think it's year-round open enrollment in the state of Connecticut, just like New York would be. Okay. Mm-hmm. Yeah.
Yeah, no, I think they're good.
Yeah, yep, you can.
Okay, let's see. Hello, I'm on Plan N. Is that as good or not as good as Plan G?
I think N's a wonderful plan. I think it's a great decision, Roger. If you decided you wanted to maybe eliminate the risk of excess, get rid of copays, and go to a G, but I think you made a fine decision. Okay. If you want to move, in fact, if someone's on a G plan, they want to move to an N plan for financial reasons, I think that's a fine move as well. Okay, I think you've chosen a great plan.
Okay.
You could shop it, by the way. Make sure you do have the best rate.
Yeah,
that's
for
always
sure.
wise.
Give us a call.
Call in, and we can shop it. Make sure you're paying the best premium possible.
Is WellCare the same as Part D for prescriptions? Yes. Mm-hmm. Yeah. I mean, WellCare offers Advantage plans too, but they're not very popular. They don't get a lot of enrollments. I keep getting a direct text from WellCare trying to discuss my plan. Glad I watched this to understand what is going on with the Cut the Ties. I love working with Darren. He's very responsive. Darren's a wonderful guy. He really is. Hey, I want to do something real quick. If you're a client of ours, please put in the chat that you're a client and let us know the name of the agent that helped you on our team. We love seeing that. Yeah, drop that you're a client. Put the name of the agent. We'll share these with them. It's pretty cool.
Yeah. That'd be great.
Does Plan D cover all med costs? No.
No. Plan Ds do cover well. You may have to cover the first $590 this year. That's the deductible. So the first 90 is on you. And then after that, you have to pay 25% of the cost up to $2,000 total out of pocket. That's the max. And that $2,000 does include the deductible, but it doesn't include the premium. And that $2,000 applies to medications that are in formulary that you bought through the plan, not just over-the-counter stuff or whatever. So it definitely does not cover all med costs. But fortunately, the most you'll spend is $2,000.
Okay, Vera Wilkinson, what do you recommend for dental and vision coverages? Well, okay, so if you're on an Advantage plan, there will be some dental and vision benefits included in that, perhaps.
Yeah, a lot of them are going to be just preventive in
Yeah.
2025, I noticed.
They used to beef those up, and they're kind of scaling back. But if you're on a supplement plan, you can get a standalone dental plan, and you can get a vision add-on. We tell people it's probably $35 to $45 a month
I'd
for
say
a good dental plan. And usually they'll cover, your 2 cleanings, 2 x-rays, 2 exams a year. So it becomes kind of like cash flow neutral, right? The amount that you'd spend on the premium is probably similar to the amount you'd pay out of pocket for the cleanings. But on top of that, you'll get about usually between $1,500 to $3,000, even up to $5,000 in some areas, of extra benefit that can be used for your teeth. So if you have root canals or whatever could go wrong with your teeth, they'll spend up to an additional $1,500 to $3,000 generally.
Yeah, and for other than preventive, you are going to have some out of pocket. It's 80-20 on your your less expensive services, 50-50 on your major stuff. But they're very good. And
what we tell people to do is get a dental plan. Don't put that off generally because they have kind of waiting periods. So, all right, if you get a dental plan, the risk is that you sign up for a dental plan because you need a crown, right? And so you sign up for it for 1 month, you pay $35, you get your crown, then you cancel it the next month, right? Well, the dental companies know that they can't stay in business if they do that. So what they do is they kind of make you wait for a little bit. So you're going to get after a year, so you're always going to get your cleanings and x-rays and exams. Those are always going to be covered. But they're going to make you wait maybe for a year before they'll start paying out on the big stuff.
6 months on the other.
Yeah, 6 months on something. So it depends on state and plan and all that sort of stuff. But generally, don't wait until your tooth is, aching, you can't sleep all night. Get that dental plan now. You can always go with an inexpensive one and upgrade later. Or if you're coming off employer coverage, a lot of the dental plans that we represent have what they call CPC, which stands for Credit for Prior Coverage. So if you're coming off of a dental plan, we can provide that policy number to them and prove that you had the dental coverage, and they'll waive those waiting periods.
And then you have immediate coverage.
That's the best thing to do is get it right when you go on Medicare.
Yeah, you need to do that. One company you have up to 60 days, another one you have up to 30 days to prove the credible coverage. So that's good.
The old man on the hill says, question, I signed up a drug plan with y'all on August 2024. Do I need to raise my hand? Yeah, go through the process. It's free for you. It's not free for us, but go through that process, raise your hand, update your meds, verify they're all correct, wait for a drug plan recommendation. And I want to tell everybody, we will be emailing you what drug plan you need to go on along with an enrollment link. Okay, we don't have we've got tens of thousands of people that we're doing this for. We don't have the bandwidth to call you and say, this is the plan you need to be on. It's going to be generated via an email to you along with an enrollment link. And we're shooting for October 21st. So we're asking everyone, get your meds updated. Raise your hand, update your meds, tell us you're done by October 15th. Give us about a week, and then we'll email your drug plan recommendation around the 21st. This is a first-time deal for us, so be patient, have some grace.
Yeah, and then also I just want to mention the reason you have to do that, old man on the hill, is because it's just a calendar year plan. That's all. You're only on that from 8/1 through 12/31. And so if you don't do anything, that plan's going to automatically renew, and that may be a good choice. But if you want to double check, that's why Josh is suggesting let's check it, because they're not lifetime like your supplemental plan. They're only a calendar year.
Okay, let's find another one. Guys, we're going to go for about 30 more minutes, but we will be back
Next Thursday.
Well, we're actually going to be back Monday and Tuesday on live streams.
Okay, good.
Or at least I'm going to be. I don't know if you're joining me, but we're going to be talking about all about AEP. So we found this is a really good way to get in touch with our clients and answer questions.
Okay.
As a reminder to all of you, if you're not yet our client or if you are our client, give us a call at this number at the bottom of the screen, 833-833-3661. And we would love to assist you, 833-833-3661. If you're not yet a client, you'll go over to our not yet a client side. If you are a client, you'll go to the client support team. And they will be able to help you make sure that you're on the right coverage for next year. Another thing, if you're interested in consuming more content about AEP, we put a website up called AEPHQ. You want to hit that banner? AEPHQ, which stands for Annual Enrollment Period Headquarters. And when you get there, if you go to that website, it's real simple. It says, are you on a supplement plan or are you on an Advantage plan? Right? Or then there's a button for if you are only interested in RX coverage. And so you're going to have those three options. You can choose, hey, I'm on a supplement plan. And then you can go through, and there's a video of Marvin that's about a 20-minute video talking all about the plan changes and supplement plan changes and drug plan changes for next year. If you choose that you're on an Advantage plan, you can watch a video of him talking about everything that's changing next year for Advantage plans. And then below it, there's some different options for ways to schedule appointments to get our assistance. Got health questionnaires for switching Medigap plans. We've got, that's a lot of resources in AEPHQ.com. So check that out, write it down, check it out. That is for our current clients. Generally speaking, if you're not a client of ours, just call the 800 number that's at the bottom of the screen, and we would love to help. Okay, are Part D deductibles all the same from Judy? Do they pay anything on the cost of the RX before the deductible is met, or nothing until the full deductible is met?
Yes. So number one, it is good. The maximum deductible is the same. Medicare sets it. It's $590 this year. So no plan can have one higher. There will be a few that will have lower deductibles, and there's some that actually have zero. Okay. And so when it comes to your question about the cost, yeah, if you have a deductible, you have to meet that first, and then the plan will begin to pay. And a lot of people, their meds. In fact, I shot a video today on the Part D changes, and you'll have that in about a week or so. But I put in 10 medications that are the most common with Medicare plans, and the costs were very, very low out of pocket. Most people, I mean, you would not meet the deductible. Okay.
Okay, I am 73 and I'm not applied for Social Security yet. Let's talk about that. I do have Medicare and use it during COVID. I understand I need to start parts A and B, but I want to just pay for it now. Which plan?
Okay. Well, yeah. First off, you should be enrolling in Social Security, because at age 70, that amount stopped growing. And I think they may pay you back, but I've never heard them going back that far. Again, I've never had that situation, so I would apply right now. You can do it. It's very simple to do, and you can actually start your benefits during the month of October. Now, you probably won't get your first check deposited until probably December, but they will start those benefits October, and then I think you will get maybe some back pay. Maybe 6 months or a year or something. I wish you'd get back all the way to 70, but definitely apply for that. And you do have Medicare, use it during COVID. I understand I need to start Part A and B. Well, if you have Medicare, you have A and B. So I'm not quite tracking there.
Okay.
Are you?
No.
Okay, I'm sorry.
Sure. Yeah, I have no idea. Okay, Margie Marion says, will I get an annual notice of change if I just signed up for coverage in June? I have ABGD and dental. Yeah, you're going to get an ANOC, annual notice of change, for your drug plan. Yeah. Absolutely. Yeah. If you haven't gotten it, call the number on the back of your card and ask them to send it to you again.
Yeah, Margie, you should already have that for sure. So Josh is right. Just call the customer service number on the card. They'll send it.
Okay, WellCare was 40 cents. The plan I'm currently on, but in 2025, it's going to be $17.40 per month. We're seeing that in a lot of states. It go up about $15-20. Anything costs about the same with different companies. Here's what you should do. You should, if you're a current client of ours, we are unable to help people just only with drug plans. If you're not a client of ours, like, we just really can't, because it's a free service. We're not paid to do this. So, but if you are a supplement plan client of ours, we still want to be able to assist you with your drug plan. So I'm assuming you're a client of ours. So go to that site or this thing. We're going to pop it up again, medicareschool.com/shop my plan. Raise your hand. Let us know you want our assistance, and then it'll take you through the process of updating your meds. letting us know you're done, and then October 21st, we'll send you a drug plan recommendation. I am on an Advantage plan and would like to find out if I change to traditional Medicare with a supplemental plan with a better RX plan. Yeah, Ducella, why don't you call us? Call the number on the bottom of the screen. Our team would love to assist you with that decision.
And Ducella, they'll share all the options with you. They'll talk to you about how that's possible, because your Advantage plan more than likely will be your coverage through 12/31. So that new supplemental plan will go into effect January 1. So they'll give you all the details. They'll shop it for you, compare prices, different plans. I think you'll be pleased.
Okay, Jerry says, I'm on Social Security, turned 65 in December, have not received my Medicare card. What steps do I need to take?
Yeah, well, probably, Jerry, what happened is you threw it away, because if your birthday is in December, November, October, so that'd be 12, 11, 10, 9, 8. You should have got it in August. It would have come around August 20th, if indeed you're on Social Security. I'm sure you are. So what I would do, if you have a myssa.gov account, you can actually go online and order a Medicare replacement card. That's what it's called, Medicare replacement card. And if you don't have a myssa.gov account, then just call your local Social Security office and let them know that you didn't get your card, and they will mail you a new card. All right? And no problem whatsoever. No harm is done. Just get a replacement card.
Okay, this is a good question. I recently enrolled in A and B, currently don't use any prescription drugs. Should I still enroll in Plan D? And now to avoid late enrollment charges later.
Yes, Don, do. And all you have to do, Don, is just get a low-cost prescription drug plan. And keep in mind, I know you don't take any now, but you may, in 3 months, need to take oral cancer meds that cost $7,000 a month. You may need to take some very expensive medication, and without a plan, you're going to have to pay full cost for those meds. But with a Medicare plan, this year, the most a person spends is $3,150. Next year, $2,000. And so the point is, you want a prescription drug plan just in case you need something expensive. And all of them have the $2,000 cap. So I would just get a low-cost plan, and you'll be happy you did it, because the penalties do add up. They're not a whole lot. The biggest risk is not the penalties. The biggest risk is needing a medication and not having a plan.
Bruce Garner says, my whole Humana plan is canceled. It's happening.
Yep.
Okay, this one says, my plan has dropped me as of 12/31/24, so do I go straight to Medicare A and B? I'm after 1/2020 as an enrollment. What would it cost me for a supplemental plan and drug plan? Would a Medigap plan help? Yeah, Diana, just call us.
Yeah.
We would love to assist you in any way we can.
Exactly right.
Virginia says, I got my plan G and RX through you in July. Do I have to do anything to stay on G and dental? No, but you should probably get a prescription drug recommendation from us.
Yeah.
But your G and your dental just stay the same.
They're lifetime, just not the drug.
Which, if any, G plans include a gym benefit?
Okay.
Yeah.
Yeah. Oh, yeah. Really, and sometimes Humana.
Okay.
They have one, but United Healthcare has two different blocks of business. They have one just UHC, and then they have one called UHICA. The premiums vary, but UHICA plans, United Health Insurance Company of America, they do not include a gym membership. They're straight United Healthcare plans do. Now, I will tell you that Humana does as well, include a gym membership on their MedSup plans, but honestly, they're not always very competitive.
Humana?
Humana.
Yeah, they have a new product out there.
Yeah, and they can be, but I don't know if
Yeah.
I don't know if
Yeah.
it has the gym membership in it.
Yeah,
So that's the difference. But again, call in, sir. Happy to find out where you live, and we'll check that out for you.
Okay, is guaranteed issue for supplement plans actually 6 months, or is it 180 days? The
Okay,
open enrollment period.
it's 6 months of your B date. So if I started, let's say I started my B date this month, October 1, because remember, we always start our B we pick the month if we're retiring later, or we start at 65. So if I started this month, October 1, my 6 months would be all October, November, December, January, February, and March. So all the way up till the last day of March, I could enroll into a plan for effective of April. I wouldn't do it that way, but you still have a full 6 months. I've never heard it was just straight 180 days. I've never heard that ever. So I believe it's 6 months.
Yeah. Is there a dental plan with Aetna Plan G? So Aetna does offer a dental plan. They offer a dental vision hearing product. We recommend it sometimes. Depends on the state. But we may want to pair you with a different plan. There's several other dental plans that, depending on the state, could be a better option.
But it wouldn't be with Plan G. It would be an Aetna
Yeah, it's
dental plan.
standalone.
Standalone. It's separate. There's no dental, no supplemental plan is going to include dental.
Arthur Burbain, is the copay plan guaranteed issue? Depends on your age.
Yeah.
So,
Could be. Yeah.
If one signs up for minimal prescription benefits, can one later change to a higher coverage of prescriptions? Absolutely. So it's a 1-year agreement. It's a calendar year thing. That's why everybody has the opportunity to change your drug plan every annual election period, which is October 15th to December 7th. And the coverage then would start January the 1st.
Right.
So you can go from a $0 plan to an $80 plan to a $20 plan to an $80 plan. I mean, it just doesn't matter.
Whatever's available in your zip code. You can get no underwriting. Just pick the plan.
Okay, this is good. This is talking about Part A deductible.
I think right, the 60 out of pocket when you have an operation or stay in the hospital. Right. Okay. That is the it's $1,632 this year, and that is the Medicare A deductible. So when you're admitted to the hospital, your out-of-pocket expense for that hospital stay, anywhere from 1 day to 60 days in the hospital, costs you the deductible only. That is it. And again, this year that's $1,632. So if I'm in the hospital longer than 60 continuous days, then I start having daily copays. 408 the third month, and then 816 month 4 and month 5. So that's what it's for. I've been in the hospital.
Steve Mazzone. I read that the monthly Plan D charge does not count towards the $2,000 max.
And that's exactly right. It's only the cost of medications that are in the formulary. No premium is part of the $2,000. You're right.
Okay, Terry Anderson says, I have Humana USAA Honor PPO and TFL, which is TRICARE for Life. The Honor PPO has some kind of drug plan, but TFL pays my prescriptions minus a $13 copay.
Yep.
Can I keep this, or do I have to use the Humana PPO? That Honor PPO won't have a drug plan.
Yeah, it will not. Right. What you have, Terry, is you have an MA only plan, which in my opinion is a wonderful option. It's MA only. So what's happening is the Medicare Advantage plan that you're on does not include prescription drug coverage. You can get your drugs through your TRICARE for Life. And usually when you have a plan like that, you're getting a Part B reduction because the Advantage company takes some of the money they receive and they credit that to you, because they don't have to be out of pocket on medications, because TRICARE for Life is covering those. Okay? Yeah, which is good. We write a lot of those kind of plans, and I think they're great.
Okay, Janice Duke. New York State, it pays, I think she means the highest sub-G premiums in the country at more than $300 a month. That sounds really high.
Yeah,
But I will say, if you're in New York, get a Plan N. Don't get a Plan G. It literally makes no financial sense.
Yeah, and because, and by the way, I think New York does allow excess, but it's like 5% or something. It's not the full 15%. But I think Josh is exactly right. I think your best value in New York would be an N plan. I really do. So, yeah.
Does Plan N cover physical therapy without a copay for every visit?
How about, okay. Okay, well, that's a great question. Anytime you see a physician, you are subject to a copay of up to $20. So I do not know the answer to your question. Okay, I know what you're talking about. This is what she's saying after like a knee replacement or something, you go in for physical therapy.
Plan on that. PT would be.
Yeah, I would think that would be the case, but why don't you call the provider and ask them that question?
Yeah, how they bill it.
Yeah.
Okay, Rick Meyer says, it seems that you are against Advantage plans versus supplemental plans.
Mm-hmm. Okay.
Any main reason why?
Yeah, well, the main reason why is because...
Well, hang on.
Oh,
Are you
okay.
against Advantage plans?
Okay, I am not against them if people know what they're getting. Rick, the reason Advantage plans are pushed is because agents we make twice the commission on an Advantage plan versus a supplemental plan. We also, on Advantage plans, get paid a lifetime residual. We never get even near close to that on a supplemental plan. So the best interest of the agent is for you to get an Advantage plan. And I think it's in your best interest to get an Advantage plan if you cannot afford a supplemental plan. And some people can't or don't want to. So then I would get an Advantage plan. And so it's not that I'm against them. I just know what happens. Go online and look at some of the reports and the complaints that people have with Advantage. No one complains about a supplemental plan. In fact, people are thrilled they have them when they go through some serious health issues. So I think people are going to be more satisfied with their supplemental plan coverage. In fact, the government themselves describes Medicare supplemental plans to be high quality medical coverage. They describe Advantage plans to be average and sometimes low medical coverage. Why? Because pre-authorizations, network issues, and in other words, there are problems with Advantage plans. But if you want one, let's find the very best one you can. We will write them. So I'm not against them. I just want you to have quality insurance. That's all.
Okay, I've been receiving Social Security benefits for approximately 2 years. I started at age 62. I've never received a Medicare Part A. I have been and will be on private insurance till 12/31/24. Well, you'll get a Medicare card about 100 days before you turn 65.
That's right.
So it sounds like you're 64 now.
Yeah.
So you should,
Not quite there.
yeah, depending on when you turn 65, you'll be getting that Medicare card about 100 days before.
Yeah, it will show up in the mail.
Arthur Burbane says, also, what exactly do copay plans cover? Okay, so a copay plan is actually a term that we made up for a technical plan called a hospital indemnity plan and a cancer plan and these other things. So what it does is it is insurance coverage that you take out to help you should something go wrong and you're covered by an Advantage plan. The things that go wrong are often cancer treatments, right? Going into the hospital, things like that. So what we will do is, let's say you're on an Advantage plan and it's $350 a day daily copay for 5 days. We will build you what we call a copay protection plan to match the $350 a day out of pocket. And then on an Advantage plan, you oftentimes have a maximum, or you will always have a maximum out of pocket. And that maximum out of pocket could be $3,000, $4,000, $5,000, $6,000, whatever it is. And so we will build that copay protection plan to cover hospital stays and also that max out of pocket should you get something like cancer. And so for $30, $40 a month, you have pretty decent coverage. And it kind of helps fill in those gaps. If you can't or don't want to afford a supplemental plan and a drug plan, you can get an Advantage plan and get that to offer you some financial protection because we don't like financial surprises. What's that sad about, like $1,000?
Yeah. Well, the sad is that 65% of all people today were asked that are on Advantage plans, if they had a $1,000 medical bill, emergency bill, could they meet that? And 65% of all people said they couldn't even come up with $1,000. So the max out of pocket is why you would get a copay protection plan. So if that max out of pocket would be difficult for you to meet, $5,000 or $7,000, some of them are going to be higher than that next year on PPO plans. Then you get the copay protection plan to get those expenses covered. I'd rather spend $35 or $40 a month knowing that at least my hospitalizations are covered, and if I got cancer, I don't have to worry about maxing out. It would help pay that. That's why.
Okay. We got about 12 minutes left that we're going to be on here. Daryl Saudi says, we've been with you guys a couple of years now. I've always been thankful for our initial call with you. Never plan on leaving. Your services are second to none. Thank you. Daryl, thank you.
Yeah. Daryl,
We
it's kind of
love
you.
to hear
We
that.
appreciate that.
Love to hear that. Okay. I have Humana. BBB says, I have Humana Choice PPO. Would you recommend going to traditional Medicare? I can't seem to find a comparable Advantage plan that will cover the doctors I have now and the medications both. As long as you're able to pay the monthly premium for the supplemental plan and drug plan.
And qualify, depending on where you are.
That's true.
Yeah, listen, you all, to go to traditional Medicare by itself is not a good move. I would not have A and B only. I think your best option, if you can qualify and can afford, get that supplemental plan G or N. But if you can't afford that, then just find the right Advantage plan. And we'd be happy to, of course, assist with that. Okay?
Okay. Good question. Joyfully Orange. Deborah says, husband is your client. Thank you. And is just now active with Part B, Plan G. When he goes to get an MRI later this month, who does he pay deductible to and when?
Good. Okay, what will happen is the deductible bill will come from the provider. So when that provider makes the claim, it automatically goes to Medicare. Medicare pays their part. The part that Medicare doesn't pay will then go back to your supplemental plan G. And so if he has not met his deductible yet, they will notify whoever, the person who did the MRI. It could be the facility fee. It could be the radiologist that reads it. But somebody is going to send you a bill for that $240. And sometimes it could be a couple somebodies. You could get one bill for $180 and another bill for $60. but the bill will actually come from the provider. So you won't pay it to Medicare. You're not certainly going to pay it to your insurance company. Just wait until the dust settles, and you'll get a bill up to $240.
Okay, a lunatic. It says, folks, call and let them help you. I did this because I didn't want to make a mistake. I did my homework about all the plans. They have easier access to all the information. They helped me, did the paperwork, signed me up, and everything went flawlessly. You don't want to mess around with government paperwork.
Ah, good.
Thank you.
All right. Appreciate the encouragement, sir, or ma'am.
Okay, trying to find some questions that we haven't asked yet. My Advantage plan is canceling. I have my guaranteed letter. I want to get a supplement plan, but we may have to move closer to one of our children. Is there a plan that covers across the U.S.? So all supplements.
Yeah, Michelle, they all will. So what I would do is get the best plan now wherever you live, and then that plan, that supplemental plan that you take will be portable, so you'll actually take it with you. And then the coverage will be the same. Now, if you move some places, your rate could go down. Some places, your rate could go up a little bit. We've had people move all across the country. It's usually not a big deal, but the plan is yours forever. The only thing they can adjust is the premium depending upon where you live. A little up, a little down. Okay?
Okay.
And Michelle, you would have to get a new drug plan. That's not portable, but it's easy to do that, and we can assist in that process.
Karen Hamilton says, would we save if my husband and I got on the same plan? I'm healthier than he is, though he's doing good. My supplemental insurance is 108 and his is 160 now.
Yeah, if you're with the same carrier, depending on who it is, you're going to save anywhere from about 10% to 20% if you're with the same carrier. That's called a household discount as well as a multi-policy discount. So 10 to 20%.
Patsy Edie says, I just turned 65 in September. I did sign up for Part A, but I continue to work and have insurance. Do I need to let someone know I'm not taking Part B?
Not at all. They assume because you don't have it, you are covered by a group plan. So as long as you stay covered by a group plan, just stay on that coverage. And then when you get ready to retire, what I would do is I would start the enrollment process about 60 to 90 days before you lose your group coverage. Okay, that's just the ideal time. 90 is great, 60 is still fine. And then we'll notify them that you're ready for Part B. Your employer will verify you've had credible coverage, and it's a very seamless process. And we'd guide you through the whole thing.
Okay, this is Billy Danley. Do you remember them? Like from a decade ago. Remember we used to meet him at, I think, McDonald's or something. That's so funny. Remember Billy Danley? Yeah. That's funny. Okay. Reminiscing. Husband and I have RP&I Healthcare Plan F, so it's been a while, for several years, paying over $200 each month. Can we switch to Plan G to have lower premiums? We are in our 70s.
Okay. You can do so, but in most states, you're going to have to medically qualify to do that. Some states you wouldn't. You could move like to less, but as a general rule, you're going to have to medically qualify. Not sure what state you live in now. Okay.
Missouri.
Yeah.
Medicare school, I could not pass underwriting during my IEP, but I don't know. That's why it is so important for everyone to get help from you guys to be sure they're on the best sup. That's an odd thing. You shouldn't have underwriting during your IEP. Yeah, interesting. Let's see. Okay, with traditional Medicare. Okay, with traditional Medicare and a supplement, I call a specialist and make an appointment. No referrals with a few exceptions. Even then, I still pick up a specialist, or I still pick the specialist.
Yeah, exactly right. There's no referrals. You just set up your own appointments with traditional Medicare. You just have to make sure they take Medicare. That's it. And they will take your sup.
Okay, what are the 7 states that do not allow excess charges?
Okay, I'm getting old, and I used to have that memorized, but I really don't. I know Pennsylvania, Ohio, Rhode Island. You can look it up. Hey, Google that. And then New York is limited to 5%. You see those states?
Yeah. Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, and Vermont.
Okay. Say it one more time.
Connecticut, Massachusetts, Minnesota, New York, Ohio, Pennsylvania, Rhode Island, Vermont.
Okay, very good. I really did know that at one time.
Okay, I'm a client. Justin Cohen, I'm a client. Love Dylan. Client.
Good.
Shanna Summit. Brian and Mark Files. Client. All these. There's a lot. Wonderful, guys. Thank you. Oh, here's a good question. We haven't answered one of these. Sorry, Marvin. I know you've answered this before, but as a Plan A date, my Plan A date is September 1, 2024. May I still contribute to my HSA in 24?
Okay. Well, it just depends. For sure, if you're maxing out, you can only put in, and keep this in mind, right now, because you're over 55, you can put in $4,150 plus $1,000. So you can put $5,150. I think you divide that by 12. I'll tell you what that is. $5,150 divided by 12. So yeah, right at $430 a month. And so if you're maxing out at $430 a month, then you have to stop, would have to stop in August. So you were fine to put in 8 months of that. So $3,433 would have been just fine. And so what you're saying is, if you didn't do that, can you still continue to put that in? I'm going to have to ask you to ask your accountant, because now your A date has started. I do know you're fine up until August at $3,433. So the question is, could you still contribute that max? And my gut feeling is yes, but I still want you to ask your accountant to make sure that you can make that contribution, because I think it's an annual amount. Yeah, so I think you should be fine, but please check.
Okay, lots of clients on here. This is fun. Okay, I think it's important. Hang on. Let's see. Trying to find a good question here, guys. Hang on. My mother is. Let's see. Okay, here we go. Is Plan G still better than Advantage Plan with all the food cards and all the extras?
Yeah. Well,
that's changing.
Yeah, and also, Teresa, the food cards, those are typically, I don't want to say 100% across the board, but they're typically for people that are also eligible for Medicaid. So that's what makes those programs so attractive, because when someone's on Medicaid, these Medicare supplemental companies, Medicare Advantage companies get more money from the federal government. So that's where that money's coming from. So unless you would qualify for Medicaid, I doubt you're going to get a plan that's going to have a food card in 2025. Yeah. That's more of a Medicaid benefit.
Okay, this is a good question. I got a letter from Mutual of Omaha that they are exiting the Plan D business and I need to replace my RX plan. Should this shake my confidence in Mutual of Omaha Plan and client Ken is great? No, not at all. Mutual of Omaha is, I think, one of the top 3. They all have them, United Healthcare, maybe Cigna. They have, or Aetna, have billion-dollar MedSup blocks. They're the biggest. Yeah. You're fine. Mm-hmm. You're fine.
Yeah. Yeah, Rick, just get a different drug plan, but yeah, your Mutual Omaha plan's fine. And like Josh said earlier, make sure you shop that every few years to make sure it's the best deal. In some markets, I found Mutual Omaha to be very stable, others not so. But just stay on top of that. But I would not have any problem with Mutual Omaha as far as financial stability.
Okay. A lot of the same questions we've already answered. Bruce, gentlemen, I have a supplement plan G with Humana. Is there a supplement plan that may have a gym plan with them? Humana does not have it. Any suggestions? Yeah, Bruce, call in. Yeah. And somebody on the client renewal side can help you.
Yeah, and Bruce, maybe that's one of the new G plan, because all the old Humana stuff had silver sneakers embedded within it. So that's interesting that you don't have that, unless it's the new one. The old ones all did. So double check on that.
Should I shop Plan G premiums, and if I change, do I have to go through underwriting? Currently, I have RPI Healthcare Plan G through you. You can shop. We're not seeing a lot of people switch. What kind of happened is plans took premium increases, but it was kind of across the board. So it doesn't make a whole lot of sense to switch around this year. Sometimes it does. But if you currently have United Healthcare, they're still competitive. Kind of a weird thing about United Healthcare is they generally, in most states, split their price increase into 2 different increases. So you'll take, it'll be kind of the equivalent of one, but it feels like, wow, I'm getting my price raised all the time, even though they just split it into 2.
But long term, they are a very stable company.
Yeah.
Virginia, if you end up living, 85, 90 years old, I think you'd be very happy that you're with them. Mm-hmm. They really are stable, especially over the long haul. But if you did want to change, we're happy to facilitate that. Depending on where you live, you may have to go through underwriting, but we're happy to shop that for you. But and again, there's some good companies out there, and United Healthcare is definitely one of them.
Thanks for all the great information, guys. Really rely on your advice. I recommend your service to everyone I know who is looking to start Medicare. Thank you, Vera.
Yes.
Okay, we will be done. We will be back, I think, Monday, Tuesday with a live stream. I'm not sure if it's on YouTube or in the Facebook group. I think join the Facebook group. And we'll be going,
Monday 1 and Tuesday 1 Central
I
Time?
believe so.
Okay.
I believe so.
And then,
Yeah. Okay, so yeah, watch them. Join the Facebook group, Medicare School. We'll drop that link again here real quick. Yeah, it's just the Medicare School Facebook group. Just a second here in the chat. Join that so you can join us again, and we'll be back here Thursday on YouTube talking about all Medicare, AEP, all that stuff. But last but not least, please, if we can help you, call our phone number, 833-833-3661, and we would love to assist you. It's scrolling at the bottom of the screen. Thank you all. Have a wonderful night.
yeah, thank you. See ya.